Welcome to the 2023 CNA Client Rights Practice Test. This test has 20 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white. Question 1. One of the residents gets confused at night and wanders into other residents' rooms. The CNA should A. Request an order for restraints. B. Use the linen cart to barricade the path to the other rooms. C. Ask the nurse to ask the doctor for sleeping pills. D. Provide companionship and supervise the resident's movements. The correct answer is D. Provide companionship and supervise the resident's movements. The care team should consider activities that might reduce the need for restraints. Residents have the right to freedom from physical or chemical restraints unless agreed to with the resident, ordered by the doctor, and necessary to protect the resident. Question 2. A resident's family member provided them with a pornographic magazine. The CNA should A. Remove the magazine and discard it at a time the resident won't notice. B. Ask them to keep it in their room to avoid offending others. C. Take it to a supervisor and let the resident know to ask for it when they want to see it. D. Encourage them to watch similar videos on the internet. The correct answer is B. Ask them to keep it in their room to avoid offending others. Residents have the right to keep and use personal belongings. Staff does not have the authority to remove the property of residents. Question 3. A resident wants a copy of their medical records. The CNA should A. Make a copy of the record and give it to them. B. Inform them that copies cannot be given to residents directly. C. Notify the resident's family about the request. D. Provide the record release forms and advise the supervisor. The correct answer is D. Provide the record release forms and advise the supervisor. Residents have the right to complete information about health status and treatment. There is a procedure for obtaining records which includes release forms. Unless the resident has been declared incompetent, the resident can provide the consent for release. Question 4. The resident refuses to eat vegetables with meals or as snacks. The CNA should A. Sit with them until they eat at least a small portion. B. Have dietary increase the amount of vegetables on their plate. C. Notify the nurse so their nutritional status can be evaluated. D. Hold all desserts until they start eating more vegetables. The correct answer is C. Notify the nurse so their nutritional status can be evaluated. Residents have free choice and the right to participate in planning care. Residents should be encouraged to eat nutritionally balanced meals but cannot be forced. CNA should report concerns about the health of residents. Question 5. 2 unmarried residents are cuddling in a common area. The CNA should A. Separate them. B. Escort them to one of the residents' private rooms. C. Notify their families. D. Allow them to enjoy each other's company. The correct answer is D. Allow them to enjoy each other's company. Residents have the right to interact with people in the community. CNA should report any concerns about a resident's health. CNA should report any concerns about a resident's safety. Question 6. A CNA is asked by another CNA to help get a resident up from the floor, but is not told what happened. The CNA should A. Help the other CNA report the event to a supervisor. B. Don't ask because everyone should respect patient confidentiality. C. Wait until the end of shift and ask the other CNA. D. Ask the resident what happened. The correct answer is A. Help the other CNA report the event to a supervisor. When a fall or injury is accidental, it must be documented and reported to the care team. Residents have the right for freedom from abuse, neglect, or mistreatment. The CNA is required to report if abuse is suspected. Question 7. If asked to sign a resident's will, the CNA should A. Agree but refuse any compensation. B. Decline and notify the family. C. Arrange for case management to assist the resident. D. Get another person to sign at the same time so there are 2 witnesses. The correct answer is C. Arrange for case management to assist the resident. Residents have the right to management of personal funds. It is not within the job description of a CNA to participate in legal matters. A referral to someone who can arrange witnesses is appropriate. Question 8. Upon finding some unlabeled pills in a nightstand, the CNA should A. Provide water and insist the resident take them as soon as possible. B. Discard them. C. Leave them alone to respect patient confidentiality. D. Notify the nurse immediately. The correct answer is D. Notify the nurse immediately. Residents have the right to refuse medications and treatment. It is not within the CNA scope of practice to administer medications. All medications should be labeled. It is the responsibility of the medical staff to determine if a resident's care plan includes which medications. Question 9. A resident's room is sloppy and the resident won't tidy up. The CNA should A. Clean the room while the resident is at an appointment. B. Insist the resident put all the things away or they will be thrown away. C. Let the resident know that some of the things are a safety hazard and help them relocate the items. D. Notify the resident's power of attorney. The correct answer is C. Let the resident know that some of the things are a safety hazard and help them relocate the items. Residents have the right to keep and use personal belongings. If belongings are moved without the resident's knowledge, it can cause distress and mistrust. Staff do not have the authority to discard residents' belongings. Question 10. A resident states they wish their life would end. The CNA knows A. Elderly people say things like that and don't mean it. B. It is impossible to harm oneself in a long-term care facility. C. The resident needs help even if they don't mean it. D. Residents have the right to harm themselves if they want. The correct answer is C. The resident needs help even if they don't mean it. All threats of self-harm are reportable and must be investigated by qualified practitioners. It is not within the CNA scope of practice to determine how serious a resident's comment is. Patient safety is the responsibility of all staff. Question 11. A sometimes confused resident reports that something was taken from the room. The CNA should A. Remind the resident that the item is not valuable. B. Help the resident look for it. C. Call the police. D. Call the resident's power of attorney. The correct answer is B. Help the resident look for it. Residents have the right to keep and use belongings. Memory can be impaired and the possibility of the item was misplaced needs to be explored. If it is not found, it should be reported to a supervisor. Question 12. If a CNA sees something a resident owns in the backpack of another staff member, the CNA should A. Assume it was a gift to that person from the resident and say nothing. B. Call the police. C. Take it out of the backpack and return it to the resident. D. Ask the other staff member and report it if it doesn't sound right. The correct answer is D. Ask the other staff member and report it if it doesn't sound right. Residents have the right to keep and use belongings. Assumptions should not be made. The situation should be investigated if it appears a resident's rights are not being honored. Question 13. If a resident is found crying in a common area, the CNA should A. Guide the resident to a private area and ask what is wrong. B. Give the resident privacy and leave them alone. C. Tell them that others are being disturbed and ask the resident to leave the common area. D. Call the resident's family. The correct answer is A. Guide the resident to a private area and ask what is wrong. Residents have the right of confidentiality of personal and clinical information. The care team should provide emotional support in addition to physical care. Compassion includes listening. Question 14. If a resident reports that a family member is stealing money, the CNA should A. Reassure the resident that their money is safe. B. Call the police. C. Notify the supervisor or case manager. D. Advise a different family member about the resident's concerns. The correct answer is C. Notify the supervisor or case manager. Residents have the right of management and security of personal funds and the right of freedom from abuse, neglect, or mistreatment. Financial abuse is reportable. Confusion and memory loss are common in the elderly. Question 15. If a resident reports that a family member hurt them during a visit and insists it be kept a secret, the CNA should A. Assure the resident that no one can hurt them. B. Call the police. C. Notify the nurse or supervisor. D. Advise a different family member about the resident's report. The correct answer is C. Notify the nurse or supervisor. Residents have the right of freedom from abuse, neglect, or mistreatment. The CNA is required to report suspected abuse. The situation should be investigated if it appears a resident's rights are not being honored. Question 16. If another staff member hides the call bell from a resident who frequently uses it even though nothing is needed, the CNA should A. Be grateful because there is no time to answer the call bell so often. B. Give the resident a fake call bell. C. Tell the resident someone will visit every hour to see if she really needs something. D. Return the call bell within reach of the resident and report the staff member for neglect. The correct answer is D. Return the call bell within reach of the resident and report the staff member for neglect. Residents have the right of freedom from abuse, neglect, or mistreatment. The resident has the right to be safe in their environment. The ability to call for assistance is required for resident safety. Question 17. A CNA is legally obligated to report A. Suspected abuse. B. Residents who refuse medications or treatments. C. Residents who smoke. D. Family members who don't visit. The correct answer is A. Suspected abuse. Residents have the right of freedom from abuse, neglect, or mistreatment. The situation should be investigated if it appears a resident's rights are not being honored. Residents have the right to refuse medication and treatment. Question 18. The CNA knows A. Sometimes you have to yell at residents when they are old. B. Residents don't usually notice when things have been moved around in their room. C. It is okay to tell the resident's family things the resident wants kept secret. D. Residents have a right to privacy and respect. The correct answer is D. Residents have a right to privacy and respect. Residents have the right to considerate and respectful care. Residents have the right to confidentiality. Moving things without permission can cause distress and mistrust. Question 19. If a resident prefers to take a bath at night, even though she is scheduled in the morning, the CNA should A. Help the resident as needed to bathe. B. Notify the supervisor about the non-compliant behavior. C. Insist the resident wait until the morning. D. Tell the resident no one can help when the rules are broken. The correct answer is A. Help the resident as needed to bathe. Residents have free choice and participation in planning care and treatment. Residents have the right to refuse medication and treatment. Effort should be made to allow the resident's preferences if it can be done safely. Question 20. A resident prefers to spend time alone. The CNA should A. Check in as often as possible to make sure the resident is okay. B. Encourage the resident to notify staff if anything is needed. C. Notify the resident's family that they don't interact with others. D. Arrange to have other residents join them. The correct answer is B. Encourage the resident to notify staff if anything is needed. Residents have the right to choose to participate in social, religious, and community activities. Residents have the right to refuse treatments. Effort should be made to allow the resident's preferences if it can be done safely. Thank you for watching this video. We hope you enjoyed it. Check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel. And please share this video with your fellow nursing friends.